Imagine a wave of patients coming in after an explosion.
Yeah.
Each case is unique, complex. You need to be ready for anything.
Right.
We're diving into the world of blast injuries, equipping you with the knowledge to assess and treat those affected by these events.
We've gathered information from experts in the field to cover the 4 types of blast injuries.
Okay.
The most common ones, potentially fatal ones, and critical considerations for managing these patients.
So let's understand the different ways explosions can cause injury.
Okay, the first type is primary blast injury. This occurs from the intense pressure wave generated by the explosion. This wave can affect organs like the lungs, the gastrointestinal tract, and the ears.
So the initial blast itself
is
what causes those primary injuries.
Yeah.
What about injuries from, like, the debris, the fragments flying through the air?
Those would be classified as secondary blast injuries. So these injuries are caused by projectiles hitting the body. Anything that the explosion propels outwards can become dangerous shrapnel.
Makes sense. What about injuries that are caused by being thrown by the blast?
That would fall under the category of tertiary blast injuries. Essentially, the force of the explosion can throw a person, leading to blunt trauma, fractures, or even amputations.
So we've covered injuries from the blast wave,
Yes.
from projectiles, and from being thrown by the blast. What about other types of injuries?
That's where quaternary blast injuries come in. This category covers everything else related to the explosion. These injuries include burns, crush injuries, or even inhaling toxic substances released by the blast.
So blast injuries can really impact every system in the body.
That's right. And it's important to remember that a patient may have a combination of these different types of injuries.
Yeah. Out of these 4 types, are there any that are considered, like, the most dangerous?
Blast lung is the most common fatal primary blast injury in those who initially survive the explosion.
Blast lung. Okay.
Yeah.
Tell us more about blast lung.
Blast lung happens when the over-pressurization wave from high-order explosives impacts the lungs directly. So imagine a powerful force squeezing and stretching the lungs. This can lead to various issues, from minor bleeding to complete respiratory failure.
Wow. What signs and symptoms should healthcare providers be looking for to recognize blast lung?
You might observe difficulty breathing, coughing up blood, and chest pain. Be particularly aware of the triad of apnea, slow heart rate, and low blood pressure. These are very characteristic of blast lung.
And you mentioned blast lung is often fatal. How quickly do those symptoms appear?
That's an important point. The signs can actually be delayed. It's possible for symptoms to not show up for up to 48 hours.
So even if a patient initially appears stable after a blast, it's crucial to monitor them for any signs of blast lung.
Yes.
How is blast lung diagnosed and treated?
A chest X-ray is essential. It will often show a distinct butterfly pattern in the lungs. Treatment involves ensuring the patient receives enough oxygen. This might involve using a non-rebreather mask, CPAP, or even intubation in severe cases.
It sounds like managing fluids carefully is also important.
Yes. Careful fluid management is crucial. You want to make sure the patient's tissues are receiving enough blood flow, but you don't want to overload their system. Sometimes a chest tube may be needed to drain air or blood from the chest cavity.
Now, aside from the lungs, what about abdominal injuries?
Yeah.
Those seem to be common in blast events as well.
You're absolutely right. The abdomen is highly susceptible to blast injuries. This is because of the gas-filled structures within the gastrointestinal tract, particularly the colon.
What kind of abdominal injuries can occur?
There's a range of possibilities. You might see bowel perforation, hemorrhage, mesenteric injuries, solid organ lacerations, or even testicular rupture.
What signs should healthcare providers be watching for to identify a potential abdominal injury after a blast?
Be on high alert if the patient complains of abdominal pain, nausea, vomiting blood, rectal pain, or testicular pain. Additionally, unexplained low blood volume can indicate a serious abdominal injury.
So those are some, clear warning signs clinicians should look for?
Yes. However, it's important to remember that the initial signs of an abdominal injury after a blast can be subtle.
Meaning that what appears to be, mild discomfort could actually indicate a more serious underlying injury.
Exactly. And if those injuries are missed, they can progress to acute abdomen or even sepsis.
So how do clinicians avoid missing these subtle abdominal injuries?
It's crucial to maintain a high index of suspicion for abdominal injuries in anyone exposed to an explosion, especially during those first few hours after the event.
Okay, so we need to be very vigilant when assessing patients in the aftermath of an explosion.
Absolutely. And this vigilance is especially important with blast injuries since they can involve so many different systems of the body.
Speaking of different systems,
Yeah.
let's switch gears and talk about ear injuries.
Yeah,
Those seem likely, given the force of a blast.
you're right. Tympanic membrane perforation or rupture of the eardrum is the most common primary blast injury to the ear.
Why is that?
Well, the ear is essentially a delicate air-filled structure. This makes it particularly vulnerable to sudden pressure changes from a blast wave.
What should healthcare providers be looking for when assessing a patient for ear injuries after a blast?
Typically, the signs are apparent during the initial evaluation. Patients might report hearing loss, ringing in the ears, ear pain, dizziness, bleeding from the ear canal, or even discharge from the ear.
Given those symptoms, I imagine diagnosing a blast-related ear injury is relatively straightforward.
Yes, usually a visual examination of the ear will reveal the perforation. The key is to remember to check for it.
All right, so we've gone over the 4 types of blast injuries and looked at some of the most common ones. What are some critical considerations for healthcare providers who are managing these patients?
The first thing to prepare for is a surge of patients in the first hour following the explosion. You need to be ready to manage a potentially overwhelming influx of casualties.
That sounds incredibly chaotic.
It can be. And here's another thing to consider. It's possible for the triage process to be upside down.
Upside down. What do you mean by that?
Typically, in a mass casualty situation, the most severely injured patients arrive first. However, with blast injuries, the most severely injured individuals often arrive later. This is because those with less severe injuries can self-transport to the hospital.
That's a good point.
Yeah,
Makes sense that people who can walk would get to the hospital faster.
it does. Another crucial point is that you need to always consider the possibility of contamination after a blast. This contamination could be chemical, radiological, or both.
That definitely adds another layer of complexity to an already challenging situation.
It does. It's also essential to remember that eye injuries are common in blast events, but can be easily overlooked.
Why is that?
Eye injuries may not be as obvious as other injuries, like a broken bone or bleeding, but if they're not treated promptly, they can have significant long-term consequences for the patient.
So what should providers do to make sure they don't miss those eye injuries?
A comprehensive and systematic assessment of every patient is key.
Now, what about patients who've experienced, like, a limb amputation due to the blast?
Limb amputation is a major red flag. It indicates a high likelihood of injuries to multiple organ systems.
What does that mean for the treatment of these patients?
Patients with traumatic amputations from a blast need a very thorough evaluation. We need to identify and treat any hidden injuries they may have sustained.
So in addition to being prepared for, like, the physical injuries themselves, what about communication? That must be really difficult in these situations.
That's a great point. Be prepared to encounter patients who may be experiencing ringing in their ears or deafness as a result of the blast. Written communication may be necessary, especially in those first few chaotic hours.
It sounds like managing blast injuries requires a true team effort.
It absolutely does. Effective care for these patients involves coordination between various healthcare professionals. You know, one thing that's often overlooked is the impact of the surrounding environment on the severity of blast injuries.
The environment, can you elaborate on that?
Of course. So the severity of blast injuries can be significantly influenced by whether the explosion occurred in an open space versus a confined area.
So you're saying that an explosion, like inside a building or a vehicle,
Exact.
would be more dangerous than one that occurred outdoors?
Yes, that's right. Explosions in confined spaces tend to result in more severe injuries and a higher mortality rate.
Why is that?
Think about the physics involved. When an explosion occurs in an enclosed space, the blast wave has nowhere to dissipate. So instead, it bounces off walls and surfaces, creating multiple pressure waves that amplify the impact on the victim. Additionally, there is the added risk of structural collapse and flying debris, which can further compound the injuries.
So knowing the location of the explosion
Yes.
can help healthcare providers anticipate the potential severity of the injury.
Absolutely. It's a critical piece of information that can guide triage and treatment decisions.
That makes a lot of sense.
Indeed.
Let's go back to blast lung for a moment. You mentioned earlier that it's the most common fatal primary blast injury.
Right.
Are there any specific recommendations for managing these patients, especially when it comes to oxygen therapy?
Yeah. High flow oxygen is crucial for preventing low blood oxygen levels in patients with blast lung. We typically administer this through a non-rebreather mask. continuous positive airway pressure, or an endotracheal tube, depending on the severity of the injury.
You also mentioned that fluid management is very important with blast lung. Can you elaborate on that?
So, fluid management in blast lung cases requires careful consideration. On one hand, we need to ensure adequate blood flow to the tissues. But on the other hand, we need to avoid overloading the circulatory system, which could worsen fluid buildup in the lungs.
So it's a delicate balance.
It is. It requires careful monitoring and adjustment based on the individual patient's needs and their response to treatment.
Are surgical interventions often needed for blast lung?
In some cases, yes. Patients with massive bleeding from their lungs, impending airway obstruction, or respiratory failure may require insertion of a breathing tube. In cases of significant air leaks or uncontrollable bleeding in the lungs, a procedure called selective bronchial intubation might be considered.
What does selective bronchial intubation entail?
It involves placing the breathing tube into the main airway of the unaffected lung. This isolates the injured lung, allowing for better ventilation and control of bleeding.
So depending on the situation, a variety of interventions might be needed.
Exactly. And remember, in the context of blast injuries, we must be especially alert for potential complications like an air embolism.
You mentioned air embolism earlier. Can you remind us what that is and why it's a concern in blast injuries?
An air embolism happens when air bubbles enter the bloodstream.
Okay.
It can occur due to the pressure changes caused by the blast wave, especially if there's damage to the lungs or other air-filled structures. These air bubbles can travel throughout the body and obstruct blood vessels.
What kind of problems can an air embolism cause?
An air embolism can cause a range of serious complications, including stroke, heart attack, acute abdominal pain, blindness, deafness, spinal cord injury, and even pain in the legs due to poor circulation.
So one injury could potentially trigger, like, a cascade of other problems.
Precisely. That's why careful monitoring and a high index of suspicion are so important in blast injury cases.
How do you treat an air embolism if it occurs?
Treatment involves administering high-flow oxygen and positioning the patient in a way that helps trap the air bubbles. This might include lying them on their stomach, on their left side with their head slightly elevated, or flat on their left side. In some cases, transferring the patient to a facility with hyperbaric oxygen therapy might be necessary.
Okay, let's shift gears a bit and talk about the psychological impact of blast injuries. I know we haven't discussed it much yet, but I imagine it can be quite significant.
You're absolutely right. The psychological trauma associated with blast injuries can be profound and long-lasting.
Why is that?
Well, consider the nature of blast events. They are inherently chaotic and terrifying experiences.
I can only imagine.
The suddenness, the noise, the violence of the explosion, and the often gruesome injuries can be incredibly traumatic. And this is true not only for the victims, but also for the first responders who witness the aftermath.
What are some common psychological reactions after experiencing a blast?
You might see a wide range of responses, from acute stress disorder and post-traumatic stress disorder to anxiety, depression, sleep disturbances, and difficulty concentrating.
So it's not just about addressing the physical wounds, but also providing mental health support.
Absolutely. Psychological first aid is crucial in those immediate moments after a blast.
What does psychological first aid involve?
It's about providing a sense of safety, comfort, and connection. Listening to their concerns, validating their feelings, and helping them connect with loved ones or support systems can make a huge difference in those early stages.
And what about long-term mental health care?
Yeah.
Is that something blast victims often need?
Yes, it can be. If you notice that someone is having difficulty coping with the emotional fallout of the blast, or if their symptoms are persistent and interfering with their daily life, it's crucial to seek professional help.
Right.
Also, be alert for signs that they may be having thoughts of harming themselves or others.
Right.
If you see these signs, it's essential to seek professional help immediately.
That's important information. Now, what about the healthcare providers themselves? I imagine witnessing these types of events and treating these patients can take a toll on them as well.
You're right. Secondary traumatic stress is a real concern for healthcare providers who work with blast victims.
What is secondary traumatic stress?
It's a condition that can develop in individuals who are repeatedly exposed to others' traumatic experiences. It's similar to post-traumatic stress disorder, but it's triggered by hearing about or witnessing someone else's trauma rather than experiencing it directly.
So it's like absorbing the trauma of their patients.
You could say that.
That's concerning.
Yeah.
What can healthcare providers do to protect themselves from secondary traumatic stress?
Self-care is incredibly important. Making time for relaxation, exercise, hobbies, and spending time with loved ones can help build resilience and prevent burnout.
So finding healthy ways to, cope with the emotional burden of the job is essential.
Exactly. And it's also important to seek professional help if needed. There's no shame in admitting that you're struggling.
Okay. Is there anything else you think healthcare providers should keep in mind when managing these patients?
One thing that often gets overlooked is the importance of follow-up care.
Why is follow-up care so important in blast injury cases?
Blast injuries are often complex and can have long-term consequences.
What kind of long-term consequences?
We can see everything from chronic pain and disability to hearing loss, vision problems, and ongoing psychological distress.
So it's not just about treating the immediate injuries, but also monitoring for potential complications down the road.
Exactly.
What are some of the key things healthcare providers should be monitoring for in, follow-up period?
It depends on the specific injuries the patient sustained, but some common areas to focus on include wound healing, fracture management, pain control, physical rehabilitation, hearing and vision assessments, and mental health support.
This has been an incredibly informative session. Thank you for sharing your expertise with us. I know our listeners will find this information really valuable.
It's been my pleasure.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.